Almost 3 years since the first case of COVID-19 was reported in the Caribbean, and the COVID-19 outbreak was classified as a pandemic. COVID-19 cases are still occurring in Caribbean communities. Added to this, there is an ongoing COVID-19 outbreak in China. In light of this, the Caribbean Public Health Agency CARPHA is encouraging ministries of health to maintain surveillance of severe acute respiratory illness, hospitalizations and deaths, PCR testing and gene sequencing of severe hospitalized cases, and those hospitalized in intensive care to avoid deaths. The agency is also appealing to the public to safeguard against the spread of COVID-19 and other respiratory viruses through personal responsibility. That is, practicing proper cough etiquette and mask wearing according to national protocols. CARPHA's Executive Director, Dr. Joy St. John, pointed out that many of the new subvariants of Omicron have been circulating in the Caribbean since last year, as evidenced by the gene sequencing results from samples submitted by member states to CARPHA. Dr. St. John said CARPHA is aware that more people are self-diagnosing through the use of rapid antigen tests, and so the current incidence of COVID-19 is hard to assess. She added that there is reduced reporting of hospitalizations and deaths due to COVID-19. She acknowledged that other viruses like RSV have resulted in hospitalizations in the latter half of 2022. Dr. St. John also stated that with the resumption of economic activity and school post-Christmas and the commencement of various festivities, it is critical that people protect themselves using the measures emphasized during the pandemic, including good hand hygiene, social distancing, mask wearing in crowded spaces, getting tested when having symptoms, and more importantly, getting vaccinated or boosted. Internationally, especially in northern countries, the flu season has been particularly harsh, with hospitals being overwhelmed with cases. Regionally, there has also been a rise in influenza and other respiratory viruses, which can lead to severe illness and, in some cases, death in the old, very young, and other vulnerable groups. The CARPHA official confirmed that COVID-19 hospitalizations still occur and persons are still dying. For GBN News, Beverly Tellisford.